A day at the Rural Geriatric Clinic starts with the team getting together at St. John's Medical College. The team comprises physicians, a nurse, a physiotherapist today, other faculty of the Community Health Department involved with other programs. Looks like we've got some visitors this day. Always welcome to see and experience our rural healthcare program. We meet at the bus and get ready to set off on the journey to the Rural Health Center, which is the venue for today's clinic. The center is situated about 18 miles away from St. John's, and it takes us about an hour given the conditions en route. Bangalore is infamous for its traffic and infrastructure, which is stretched to its limit and which stretches us to our limits. And the road to the rural area pretty much gets you in shape. Mugalur is the name of the village where St. John's Medical College has its community health training center located. It's a typical village in this region of southern India, with its proximity to Bangalore evident in terms of recent changes in the social structure. Less people are agrarian, and more are into the cash economy, fueled by the real estate boom in this part of the world. But as with all other economic shifts, this one too has brought in disparity and lopsided growth, with much wealth being concentrated in the handful of a few. Rural folk are unique and distinctive in their habits and lifestyles, with this person preferring to use black charcoal for white teeth. The village has its share of fancy buildings, like this one situated next to the Rural Health Center. Mr. Shetty is 74 years old, has congestive heart failure, and is doing well on therapy. Along with the other older residents of Mugalur village, he approaches the center for the monthly clinic which is conducted here. At registration, elders hand over their notebook to our staff. The notebook is the patient retained record of his or her health status. Their weight is recorded in the notebook, and they join the group in waiting for a consultation. Before the consultation begins, they assemble as a group for a health educational session on a topic relevant to their health. Today's topic is exercises for a strong back, and the physiotherapist demonstrates on a junior resident. The group listens, and then one of them volunteers to try it out for himself. We try to make these sessions as participatory as possible, trying to engage the group of seniors maximally. The topics for these sessions usually focus on diet, lifestyle, and preventive interventions for specific diseases like hypertension and diabetes mellitus. After the session, Mr. Shetty waits to see the doctor. The consultation then follows, on this occasion with our physician on the team. Patients are seen, their caregivers are interviewed, and an assessment is made. Following examination of the patient and a detailed discussion with the caregivers, the current status of the patient is assessed. Blood investigations are performed at a subsidized cost for our patients at the rural geriatric clinic, with blood being collected at the center and analyzed at St. John's Hospital. Results are made available at the clinic on the day of the rural geriatric program. The patient and caregiver are counseled and leave to collect their medication. Following the consultation, patients receive their drugs, which are again procured at low cost and dispensed with an additional subsidy. There is additional counseling given at the time of dispensing and a reminder about the next clinic. The low cost of drugs and investigations has improved patient compliance at the rural geriatric clinic and is critical in long-term therapy. Following his experience of education, consultation and counseling, Mr. Shetty leaves the rural geriatric clinic.